Hello and welcome to this online lecture on risk-based surveillance. My name is Katharina Stärk. I am Professor of Veterinary Public Health Policy at the Royal Veterinary College in London and also Director at the consultancy company SAFOSO in Bern, Switzerland. I have worked on animal health and food safety surveillance over the last 20 years, both in an academic, industry and government role. It is a pleasure to share some of this experience with you today. This lecture was produced as part of an international research project on surveillance funded by the European Union. The project is called RISKSUR. It includes work on various aspects of animal health surveillance and ran from 2012 to 2015. There are 12 partners in RISKSUR from 10 European countries. This includes partners with both academic, industrial and government backgrounds. The target audience of this lecture is participants who have some basic understanding of animal health and food safety surveillance, its objectives, components, and the methods commonly used. The objective is to provide a general introduction to the concept of risk-based surveillance, to compare it to conventional surveillance and to highlight differences. I will also provide some examples to illustrate this approach to surveillance. I assume that participants have either a background in veterinary medicine or are familiar with common animal diseases, their clinical presentation, as well as the key aspects of pathogenesis and diagnosis. But before we start, I would like to ask, why are we interested in risk-based surveillance in the first place? This concept emerged at the beginning of the millennium when resources for surveillance activities were increasingly limited. It became clear that it was not possible to equally address all demands for surveillance, including all hazards. Just as an example, when considering foodborne hazards, there is an almost unlimited number of combinations of products, hazards, and food business operators that could be included. Obviously, we cannot achieve all of this, and thus we need to set priorities. One way to set priorities in such a context of an increasing need for surveillance but decreasing means is to try to make optimal use of resources such that the best possible evidence is obtained per investment. In economics, this would be called improved efficiency. The aim is to try to either obtain more evidence per cost unit or, if we need to reduce the budget, to obtain the same information with less cost. Both attempt to optimize the evidence-cost ratio. Either way, we need to set priorities, and there are basically two options to do that. One is to set priorities at an early stage when we select hazards for which surveillance is to be conducted. For example, we could select Campylobacter and Salmonella as common foodborne hazards and not include less frequently isolated hazards. A second option to apply a risk-based approach would be in the design of surveillance by focusing on certain parts of the population, called strata, where there is a higher chance to find the hazard. For example, if we were looking for Trichinella, a parasite mainly occurring in wildlife, we could focus on pig farms that have outdoor husbandry systems and therefore are at higher risk of infection. Either of these two approaches consider risk to set priorities and would therefore be called risk-based. To summarize, the objectives of risk-based surveillance are to increase efficiency in surveillance. This requires to be aware of the most important surveillance needs, to set priorities, and to allocate resources to these priority areas. Also, to turn this objective around, we would have to be able to demonstrate that by using a risk-based approach, we are actually increasing our efficiency by either obtaining more or better information at the same cost, or the same quality of information at a reduced cost. It should be possible to quantify these advantages through formal evaluation of the programs. These considerations lead to the definition of risk-based surveillance as shown here. More background is provided in the article by Stärk and colleagues, provided for your download in the Files window. As risk assessment is an essential method in the design of risk-based surveillance, we also provide its definition here. It is important to note that the term risk in this context has two components: the probability of an undesired event and its consequences. This is different from how the term risk is used in general in epidemiology. Please take a moment to make sure you understand the difference. You could also consider the article by Angus Cameron, which is provided in the download window. After having clarified the definition of surveillance, let's now move on to the steps involved in its design. Earlier I said that one way to make surveillance risk-based was to use risk assessment in the selection of the hazard that will be considered. This step will be closely related to the overall objective of the surveillance program. Sometimes there will not be flexibility in terms of hazard selection, so this step may then not be relevant. Once you move on to the design of the surveillance best fitting your agreed objective, there are a couple of steps where strata or also products could be selected to focus on and to make surveillance efficient. In this task, you would consider risk assessment in terms of likelihood of occurrence, but possibly also consequences. Unless you are conducting a full survey, there will ultimately be a selection of units to be included in the end. Please remember that this selection should be at random, regardless of whether you are designing a risk-based or a conventional surveillance program. When reading some articles on surveillance, you may come across the term targeted surveillance. This term is used in the context of selecting specific population strata. It was first used in the context of BSE surveillance. Targeted surveillance will always be risk-based surveillance, but not all risk-based surveillance will be synonymous to a targeted selection. I find it useful to consider the steps in the design of conventional and risk-based surveillance side by side. This is shown in this table and also on the following slides. Whenever there is a difference in a step, this is shaded in color. On this first slide, this is done for hazard selection where risk assessment could be applied when using a risk-based approach. The table continues on this page where different levels to specify the population to be included are listed. In a risk-based design, risk assessment would be used to select the most relevant strata. This could also refer to the most appropriate time to conduct surveillance. For example, in vector-borne diseases there will be seasonal differences in occurrence depending on vector activity. In this situation, it will not make a lot of sense to conduct surveillance activities year-round. Here are a few examples of risk factors that could be used to target specific population strata. Please note that this list is only for illustration and will not be complete. It will depend on the epidemiology of a hazard to determine which factors are relevant. Going through this list, try to think of examples of hazards where the factors would or would not be relevant. Returning to the table, the next step in the implementation would be data analysis, communication and feedback. It is highlighted here that specific analytical methods will be applicable when analyzing data from risk-based surveillance. It is beyond the scope of this lecture to go into the details of such analysis. We recommend that you consider relevant textbooks. Finally, feedback mechanisms are different in risk-based approach. This is primarily due to the fact that initially risk assessment methods were used to inform the design. Of course, the information created by each round of surveillance can itself be used as input to this risk assessment. The latter should be then updated regularly to keep the focus valid. This is also shown in this graph. If we start with the risk assessment, this is typically used as the basis for risk management and risk communication. In risk-based surveillance, it also informs the design of surveillance. This will provide information that can be used as input for risk assessment. If this cycle continues over a few iterations, you can expect that your surveillance might become more and more focused. This also harbors a risk. We are aware that risk assessment have some inherent uncertainty. It is possible that we therefore end up focusing on the wrong part of the population with a risk-based approach and could potentially miss cases occurring in another part of the population. Let's keep this in mind. We will come back to this. There are a number of well-established risk-based surveillance designs that are by now included in international surveillance standards. You will notice that quite a few of these are involving wildlife or insect vectors. We will look at some of these in more details in this part of the lecture. I have also added risk-based inspection here, being aware that this is not a typical surveillance activity. However, inspection can contribute to the generation of information, and it is now often conducted using a risk-based approach. For example, establishments that had problems in the past may be more likely to be visited again, or animals coming from a farm that had health problems in the past may be more likely to be sampled. The surveillance of bovine spongiform encephalopathy, or BSE, was the first ever following a formal risk-based design. The key characteristics of BSE that make it a very suitable candidate for risk-based surveillance are listed here. The main points are that it is very rare and very expensive to diagnose. Diagnosis is only possible in dead animals. There is therefore a lot to gain from focusing efforts on where the probability of detecting a case is likely to be high. Considering the clinical presentation of BSE, the best chances to find cases are in animals that are clinically not normal when coming to slaughter. In the current version of the International Standards for BSE Surveillance, an initial risk assessment is expected to determine which level of risk for BSE occurrence a country should be in. The outcome of this risk assessment will determine the intensity with which surveillance should be conducted. This is here labeled as Surveillance A or Surveillance B. The target is to collect a certain number of surveillance points. The required number depends on the population size of the targeted animals, here cattle of at least 24 months of age. You can see that type A surveillance requires more points than type B, indicating a higher intensity of surveillance in type A. If you remember from the last slide, type A was required in countries with controlled or undetermined risk, while countries with negligible risk can do type B. This means less intense checking. While this does make sense in terms of health status, as in higher status countries have to invest less in surveillance, it does not necessarily make sense statistically, because once the disease becomes rare, so that is in type B countries, the sample size should actually increase. Going back to the points that can be collected, this table shows how many points can be gained by checking one animal of a certain age category and exit route or stratum. Can you find the combination that is yielding most points? The intention of this table is to make sure that countries are focusing on high-risk animals by offering an incentive, that is, more points. It is also clear that it may be more difficult and more costly to recruit an animal as a clinical suspect rather than one in routine slaughter. Another example where risk-based approaches were established is surveillance for avian influenza. Here is a summary of its epidemiological features that make it attractive to risk-based surveillance. Again, the occurrence is rare, at least the highly pathogenic form. Note that there are many different influenza viruses in birds, not all causing disease and therefore not all equally relevant for surveillance. Highly pathogenic strains are rare, but they can occur in healthy wild birds. Following the risk assessment logic, we should consider the following points in the design of a risk-based surveillance approach. First, the probability of infected wild birds being present. Not all susceptible species will occur in all regions. Keep in mind the highest risk of introduction will be in migratory birds. Second, the probability of transfer from wild to domestic birds will depend on whether there are domestic birds present or not. Also, the consequences of infection will not be equal for all farms. Incursion in a backyard holding will have less impact than incursion into a farm producing day-old chicks that are sold to hundreds of other farms. Let's start with wild bird abundance. Characteristics such as susceptibility, tendency of living in flocks rather than solitary, and probability of interacting with domestic birds are all relevant for the risk of virus introduction. Based on wild bird testing and also based on experiments, it is further known that not all wild birds are equally susceptible to avian influenza virus infection. Here is a list of the 24 high-risk species for Great Britain, based on both their susceptibility and behavior. Of course, this list will vary from each country and will depend on the availability of data on wild bird occurrence. The following slides all focus on Great Britain, where this risk assessment was conducted and used. Thanks to the availability of very detailed data on the occurrence of different bird species around the country, maps could be developed, like this one, for each high-risk bird species. Each square of 10 by 10 kilometers is colored according to the probability of occurrence of AI infection. In this example, we see the data for Wigan in January. When combining all data for all high-risk species, a map like this can be created. In the next step, data were used from the National Poultry Register to assess poultry exposure. It is known that such registers are never totally complete, but large holdings are likely to be included. Again, each holding was given a risk score regarding the severity of consequences in case of an incursion. The results of this part of the analysis are shown here. Dark areas are where most of the large poultry holdings are. Next, the maps of incursion probability and consequences were combined. The result is this map here. This map was then converted into the following more low-resolution version. This was used to set priorities in surveillance activities, which could include, for example, collection of dead wild birds for sampling or testing free-range domestic poultry holdings. Such surveillance programs were implemented for avian influenza in many countries, although not all had the detailed data shown in this example, so the degree of targeting does vary depending on data availability. I think it has become clear by now that both conventional and risk-based surveillance approaches have advantages and disadvantages. These are listed here. With conventional surveillance, the main advantages are that we know how to do it and everybody understands the methods. However, they may be very expensive and inefficient. Risk-based surveillance, on the other hand, is attractive for rare diseases, but methods are less established and may require more technical competencies. Also, trade partners may be reluctant to accept them, which may ultimately override the economic advantages. A further point is that risk-based designs are not equally advantageous for all surveillance objectives. This is summarized here. You can see, while there is always a benefit in being able to focus on hazards that are most relevant, the selection of high-risk strata is less important when proving freedom from a disease, as here it is crucial to be able to demonstrate that it is absent from all strata. Finally, as said before, units within strata should always be selected at random, regardless of the surveillance objective. These points are further illustrated here using the picture of a river system. While sampling for early detection should focus on the spring areas of disease, so to speak, demonstrating disease freedom will require information from all streams to be integrated, so sampling at the mouth of the river will be most relevant. Please read the article by Angus Cameron for more information. It is provided as a download from the Files window. In this last part of the lecture, I would like to discuss surveillance challenges as they occur in the real world. Surveillance in practice tends to be more complex than envisaged in theory. There will often be more than one surveillance activity, using different approaches and designs. Data sources may be very diverse, and many pieces of information need to be integrated to address a joint objective. At the same time, resources are limited and costs need to be minimized while assuring quality. This table provides a simplified overview over different surveillance approaches, shown on the left, and designs across the top. Some examples are provided for each combination, but there will be more. The choice of combination will depend on the objective and the practical context, and several components with different approaches and designs can be combined. Now let's consider an example such as surveillance for African swine fever. Most countries will use suspect case reporting for this disease because there are clear clinical signs. Additionally, informed by risk assessment, an important incursion pathway could be wild boars. So one could add a component based on an active testing approach using risk-based design by including areas along the borders where a first incursion could be expected. In a situation of increased alert, one could even envisage a component where wild boar would be actively hunted for testing and early detection purposes. Results from all the surveillance activities combined would provide the evidence on the current status of the country regarding African swine fever. Many compulsory surveillance activities are described in relevant international standards, such as the OIE Animal Health Code. As a reaction to technical developments in surveillance design and also as a reaction to more and more limited resources, standards are being revised. The aim is to focus less on defining the inputs, such as the number of samples to be tested, but rather the outputs that needs to be achieved. for example, the level of confidence of the absence of disease. This is welcomed by most surveillance managers as it offers more flexibility to include local conditions and needs. We are coming to the end of this lecture. I would like to remind you that although this lecture focuses on risk-based surveillance, all the epidemiological concepts relevant to conventional surveillance remain valid. A special situation exists in relation to the issue of bias. Bias generally to be avoided. However, one could say that it is introduced intentionally when we apply a risk-based design. This is to be kept in mind when interpreting the results. Ultimately, the quality of surveillance program will be assessed by considering the validity of the data obtained, their economic value, and their relevance for risk management. This is the end of this lecture. I thank you very much for listening.